Hello, I'm Janine Kakmar with PHTV Channel 4 Palos Heights with our show Healthcare Experts in Your Corner. And today we're here joined with Diana Ducci from Ducci's Insurance Services, and she's here to talk about an important topic today about Medicare annual enrollment has started. And Diane, as an insurance broker, is here to talk about Medicare and all the things you need to know about it, or most of the things, right?
Right. Thank you so much, Janine, and it's a pleasure to be here again.
It's great to have you.
Thank you. Janine, you know, I always think it's a very important topic of discussion at this time of year because it is the Medicare annual enrollment period. And it actually started on October 15th and it ends November 7th. And many people will think, oh, I've got 7 weeks to make up my mind about Medicare prescription drug plans. However, time goes fast.
Yes, it does. Yeah.
We're already at Halloween. Today is Halloween, the day of our taping. So I would like to talk about Medicare Part D plans a little bit. I'd like to also touch on how people can enroll in Medicare because many people might be turning 65 and they want to know some basics.
Right.
So maybe would you think we should start with the basics first?
Sounds good.
Okay,
yes.
great.
Yeah.
Well, as Janine knows, and as many of you may know, I've been in the insurance industry for many years, and part of my job is to educate people about Medicare, but I'm also an insurance broker. And so I always like to remind people that when they are turning 65, about to go on Medicare, if they are receiving Social Security benefits already, as some people do as early as age 62, they will receive their Medicare card in the mail automatically about 3 months before they turn 65. So my birthday's in October. If I had turned 65 this year and had been collecting Social Security, I would have received my Medicare card in July. Yeah. So, however, my Medicare coverage would not start until the first day of my birthday month. So it would start October 1st. So some people say, well, gosh, I'm not collecting Social Security until maybe age 66 or later. Well, then it is their responsibility to enroll for Medicare. How do they do it? Some people may choose to go to a local Social Security office, and we're lucky we have one right over in Palos Hills on Roberts Road. However, some of us may just say, I want to go online and sign up for Medicare. And a person can do that. And a very popular website that I like is Medicare.gov. And that's Medicare.gov, as in victory, G-O-V as in government. And if they like, they can go to that website, and there are 3 little green boxes on the homepage, and it says, apply for Medicare A and B. They can simply touch that. It'll take them actually to the Social Security website, but right to the online enrollment form. And they can enroll for Medicare A and B in less than 10 minutes.
Wonderful. Wow.
And again, right, so if in a person's birthday month, if they're turning 65, say in October, they can go online and enroll for Medicare A and B as early as July, with that effective date being October 1st. So with that little 10-minute process, it makes it easy, right?
Sure.
Some people may say, well, I want to go into Social Security. That's fine. They can call Social Security and make an appointment. They could go to SSA.gov, SocialSecurityAdministration.gov, and they can make an appointment that way or
do
find
they need
their
to
phone
make
number.
appointments, or?
You know, that's a good question, Janine. Do they need to make an appointment to go to Social Security? Some people recommend it, and then sometimes I'll just say, well, just run over there on a morning like today, Halloween, where people probably are thinking of other things to do besides that, and maybe if they just run over there about 9 o'clock in the morning, they'll get a number and they'll get squared away. And I've understood that that works out fine for many people. But so signing up for Medicare A and B can be easy. And a lot of people say, well, what do Medicare A and B cover? Well, Medicare Part A, of course there's 4 parts, right? Medicare A, B, C, and D. And with Medicare Part A, that covers our inpatient stays in hospitals. So as you can imagine, that's very expensive, right? So staying in a hospital is expensive, so Medicare Part A is very important. And it is premium free for most people because all the years that we or our spouse are working, as long as we're paying into the Medicare system, and we have 40 calendar quarters paid in, we receive Medicare Part A premium free. Great.
Okay.
So many people say, well, what else does Medicare Part A cover besides hospital stays? It covers skilled nursing stays. So that's important too. We may go into a skilled nursing facility following a hospital stay for rehabilitation.
Okay.
And it covers other things like home health care and hospice and blood or drugs that we receive while we're in the hospital. But we typically associate Medicare Part A hospital. And on our Medicare cards, it'll say Medicare Part A hospital coverage. And then people say, well, what does Medicare Part B do? Well, Medicare Part B is just as important as Part A. However, it's not premium free. We do pay a premium for that. And the standard Part B premium this year is $134 a month. But what does it cover? Physician's care. Very important. So it covers the simple office visit I have if I have a cold, but it also covers the surgery that I'm getting in the hospital. So that physician's fee is covered that way. Anesthesiologist services covered under Medicare Part B, outpatient services, emergency room, ambulance, and many preventive services. So it is this combination of A and B together that forms the foundation of our medical care when we're 65 years of age.
You know, you mentioned the $134. Is that something that changes each year?
Oh, that's a really good question. So the standard Part B premium this year is $134, and it may or may not change for next year. I don't know. I did check this morning. I check every day.
Do you?
Well, lately, because we're waiting for that information to come out.
Okay.
So they came out with the increases for Social Security, the COLA, cost of living adjustment for Social Security, and I believe that that may have been about 2%. So since they came out with that, they should be coming out with the Medicare Part B premium changes, if any, for next year, any day.
Okay.
But also, you probably noticed that I said the standard premium for Medicare Part B is $134. That's for people turning 65 and going on Medicare Part B this year.
Okay.
And as many people know, some people pay more for Medicare Part B, and that is because it is based on income.
Got it.
So if people make over a certain amount, and those amounts this year, if a single person is making more than $85,000 a year, they'll pay more for Medicare Part B. A married couple filing jointly, making over $170,000 a year, also pay more.
Okay.
And they don't look at it in this year. So if I'm turning 65 in 2017 and going on Medicare A and B, it's a 2-year look back regarding my Medicare Part B premium. So they'll look at my 2015 income tax return.
Okay.
Okay. And I don't have to provide that to them. They are able to access all of that information.
Security, right?
Right. So Medicare A and B, very important. However, even though it's very good coverage, it doesn't cover everything.
Okay.
There are deductibles, co-payments, and co-insurance that people need to have coverage for, typically, unless you want to be responsible for it by yourself. So many people buy a Medicare supplement plan. A Medicare supplement is an individual health insurance policy designed to help with the costs that Medicare A and B leave people to pay.
Okay.
And fortunately, there are just 10 standardized plans to choose from. So a person can look at the 10 standardized plans, figure out which one works best for them, and then they can look at the insurance companies who are offering them, and they can make their purchases based on reputation of the insurance company, price, and maybe some other things as well. But since these plans are standardized, 10 different plans, many of the supplements, people will say, oh, I know what Plan F is or Plan G. I like to say Plan F is Plan F is Plan F. No matter who you're buying it from, the Plan F benefit package is standard among the insurance industry.
So how do you decide who to get it from? Is that...
And that's a good question too. So how do you decide who to get it from? Well, a lot of people like certain insurance companies because maybe they've been covered by them most of their working lives, so they want to start there. A good way to get an idea is actually this book, and I think you're going to show it later, Medicare and You, 2018.
You can face it out.
And of course, this is available through Medicare. Many people already have one in their home. Or a person could call Medicare, 1-800-Medicare, and ask them for a book. like this. But with the Medicare supplements, once a person reviews the plans and determines which one is best for them, they may look at an insurance company based on like how quickly do they pay their claims, because they, you know, what does their doctor recommend? Which supplement would your doctor recommend for you to have? And then they want to talk to their friends and relatives to make sure, you know, what kind of experience they have had.
And we all also those plans are in the book?
Well, they are in the book, and Medicare does publish another good book too, and it's called the Medigap Guide, and that's also published by Medicare, and I like the Medigap Guide, and I unfortunately didn't have one to bring with me this morning.
But you can find it on their website?
Absolutely. A guide to Medigap plans. So it's funny though, with Medicare A and B, you could buy a Medicare supplement, and that's just 2 parts of Medicare A and B in a supplement. And you say, well, what about drugs, Diane? And Medicare Part D has been around since 2006, and that is a plan, the Medicare Prescription Drug Plan, to help people with the cost of their prescriptions. So typically, if a person enrolls in Medicare A and B, and they buy this Medicare supplement to help them with the hospital and medical deductibles, co-payments, and co-insurance, they usually need a prescription drug plan as well. And with the Medicare Part D prescription drug plans, there are 24 to choose from next year, Janine.
Oh my God.
Yeah. So
is that continually increasing over the years?
Well, this year there were 23. There may have been more at one time, and that's just in Illinois. Right. So it's like, how do you choose
that was
plan?
My next question. How do you choose, and where do you get that information from? And
well, that information for sure. The Medicare Part D plans are all listed in the back of the Medicare and You handbook. So that is one easy way to do it. And a lot of people say, well, I am just going to buy my drug plan from the same company that I buy my Medicare supplement from. And that may work out very well. However, I do suggest that people spend about 30 minutes doing some homework. And doing this homework, they can say, I have my Medicare supplement with this company, but now I'm going to look at my Medicare Part D plan, because there is no advantage for the person to buy both from the same company. All right? So they should buy a Medicare prescription drug plan based on how that plan will cover the drugs that they take. You may take prescription drugs, I may take prescription drugs. They might not necessarily be the same. So we might both need a different plan. So a really good way to figure this out is go to the Medicare.gov website. And on that home page in a little green box, it says Health and Drug Plans. And I could click it, and it'll ask me my zip code, and it'll give me prompts. I'll put in my zip code, letting them know I live in Illinois. They'll ask me a couple other questions, and they'll give me the opportunity to put my prescriptions in. And then I can type in my prescriptions, the exact name, right? And I would want my pill bottles, because some people will say, oh, I take Crestor, but maybe they really take the generic version.
So you really have to be specific.
Very specific, because I know that just messing up on a vowel on a generic name.
Those are so how do you spell that? And how do you pronounce it?
Right. Yeah, I have a hard time pronouncing many of them. So they should sit there, and I always just suggest they should take about 30 minutes and just say, okay, I'm just going to spend 30 minutes doing this. If they're taking 1 or 2 prescriptions, it won't take them long at all. But some people take many, and so they need to just be patient and put in the prescriptions. And once they do, they'll click, my drug list is complete. And they should notice that on the right-hand side of the page, a drug list ID number has been formed.
Oh my gosh.
Yeah, and they should write down that number. Because if they have written down many drugs into this list, they don't want to redo it later, right? So they should write down the drug list ID and the date that they're doing it. It's called the password date. And then they can go to the next page, and it'll always prompt them, and it'll ask them to put in a couple pharmacies, and they should put in a couple pharmacies, maybe some major chains that they like to use. And then the next step, they'll be able to review all of the plans. And what I like about this software program that's on the Medicare.gov website, it houses all 24 plans, their formularies, and all of their information. And once I give it the information about the prescriptions that I take, it'll search all the plans, looking for the plan that will cover my drugs in the least expensive way for the remainder of the calendar year.
Wow.
So a lot of people will say, oh, I looked at the premium. You know, the premium is important, but really what's important is this little number on the left-hand side underneath the name of the Part D company, and it's called annual drug costs. And this is an estimate, but the estimates are usually pretty accurate. And that annual drug cost will take into account the monthly premium of that plan. And it'll take into account the co-payments that person will have for those particular drugs during the calendar year. And if they go into the donut hole or coverage gap, what their costs will be. So it'll take all that into account. So people will look at that and they'll say, okay, that's good, and that's the least expensive one out of all of the options. But you may say, but Diane, I don't like that insurance company. That's fine. Look at the next one and see their lowest annual drug cost. Because if they're close, then what's the difference? Because you want to be satisfied.
Sure.
But don't hesitate to click the name of that company, because then it'll show you all of this information, how your drugs are covered, customer service ratings on that plan.
Oh, wow.
Yes, it's a beautiful software program that people, I always, when I give like my classes on Medicare Part D, I always instruct people how to do this, because there is a star rating on Medicare of up to 5 stars based on what consumers like you and I feel about the plan, so they should look at that.
Yeah, absolutely. I mean, it's just so many decisions to make, so many, you know, numbers and words to deal with, that to have that all spelled out is pretty helpful.
It is very helpful. And some people may say, I'm not good on the computer. I don't want to do that. And I understand, and you probably do too. At the end of working for the day, the last thing you want to do is look at a computer again. So first of all, you know, make it fun. Do it with a friend. Okay, that's one way. Or there's lots of help around. We have plows right in town in Palos Heights, and I know the number's going to be on the screen later.
For those of you who don't know what PLOWS is, it's a, go ahead.
Oh, okay, it's an organization right in town that can help people with many things, help seniors, right? Help seniors with many services that would be available to them, but it can also help them with Medicare Part D plans, how to choose one.
They're an incredible organization. Great group of people there too.
Absolutely, absolutely. So PLOWS is one way, and I would suggest that they do make an appointment with them. And then another thing they could do is with our local hospitals like Palos and Christ Hospital, Advocate Christ, we have SHIP reps. SHIP, like Senior Health Insurance Program reps.
SHIP with a P, yeah.
SHIP with a P. And there are representatives at both of those locations that can help people enroll in a Medicare Part D plan.
Okay.
So
do they have to pay for that?
No, they don't.
Oh, wow.
SHIP is an organization funded by the state of Illinois, and there are volunteers and there are paid employees, but they do not have to pay for that kind of help.
So we will be running those numbers on the screen, so if you guys need to take note of those phone numbers, it's a good free source of information.
Absolutely.
Yeah. Okay.
But the Medicare.gov website, when you're choosing a drug plan, you know, the open enrollment period started October 15th and it ends December 7th. And people may say, well, what is that annual enrollment period all about? It's about changing your prescription drug plan, or maybe if you're in something called a Medicare Advantage plan, it's about changing that. And so some people say, well, what's a Medicare Advantage plan? Well, that's the third part of Medicare.
Okay.
We mentioned A is hospital, B is medical, D is prescription drug, and C is something called Medicare Advantage.
Okay.
And a Medicare Advantage plan is an alternative way of receiving your Medicare coverage. You know, with Medicare A and B, if we receive it in the original way, we're getting our coverage right through the federal government, and we have the option to use any Medicare-approved provider in the country. Along with that freedom of choice becomes our responsibility of deductibles, co-payments, and co-insurance. And like I said, many of us will buy a Medicare supplement plan to help us with those costs. And for prescription drugs, we would want to buy a standalone Medicare Part D plan, which, by the way, those Part D plans range in price from about $16 and change every month to over $180.
Depending
on, you know, the drugs that they cover, their deductibles, their co-payments, and their co-insurance.
And the number of drugs we take.
Well, the number of drugs we take, that's not what the price is based on. The price is usually based on, is there a deductible? Where does it apply?
Okay.
Which tiers? You know, and I could talk for an hour, not that anybody wants me to, about Medicare Part D, but what I really want to stress during this segment is that people really need to do their homework.
Okay.
And it's not hard. Right. Medicare.gov makes it easy. There's PLOWs, there's the SHIP representatives, and if they are working with an insurance agent, their insurance agent can help them with that too. And just look at the options that are available to them.
So there is help. I mean, you can do it by yourself if you feel comfortable doing that, but you also have those resources that we talked about.
Right, right.
But now you were talking about the Advantage plan.
Right. So Medicare Advantage, that's Medicare Part C. An alternative way of receiving your Medicare coverage, because with a Medicare Advantage plan, you don't receive your Medicare coverage from the federal government, you would receive it from an insurance company offering a Medicare Advantage plan. And this insurance company has been authorized by Medicare to provide you with your Medicare A and B coverage. However, instead of using any Medicare-approved provider, you would use a network of doctors and hospitals that have been contracted with that insurance company. So typically, a Medicare Advantage plan is an HMO, Health Maintenance Organization, or a PPO, participating provider option. And as you probably know, with an HMO, we usually need to choose a primary care physician, and that primary care physician becomes our coordinator for our medical care needs. And so they would refer us to specialists when we need to see them. So with an HMO, we need to follow the plan rules and use the referrals that our physician recommends. And there's always an option, you know, that included in all of them for emergency coverage if you couldn't use your doctors.
All right. And then what about, what else do they need to know about the Advantage Care plan?
Well, with the Medicare Advantage plans, people ask, a common question is, why is it called an Advantage plan?
Right.
Because so far I've told you that, you know, you have to use a network of doctors and hospitals, and that's not like original Medicare. Well, Medicare Advantage plan not only offers you Medicare A and B benefits, but it usually includes prescription drug benefits as well. So that would be one less thing a person would have to choose. And with a Medicare Advantage plan, you don't and cannot buy a Medicare supplement with a Medicare Advantage. See, the Medicare Advantage is a combination. You may want to think of Medicare Part C combining A, hospital, B, medical, and most often D, prescription drugs. And with this Medicare Advantage plan, along with using the doctors and hospitals within the network, I would have co-payments and co-insurance amounts to be responsible for my services when I receive them. The advantage to the Medicare Advantage plan is maybe the premium could be $0 for that. And people say, well, gosh, that's interesting. And maybe because a Medicare supplement, on average at age 65, let's just say maybe between $120 to $160 a person, you're thinking maybe this Medicare Advantage plan might work out okay for me, right? Be less expensive for me as far as premium goes. And that's fine. A person, when they're looking at a Medicare Advantage plan, should again do some homework. Find out how their drugs are covered, but also see, are your doctors in that network? Is your primary care physician a part of it? If you have specialists, are they part of the same medical group? Because oftentimes, especially with the HMO, when you choose a primary care physician, they will typically refer you to specialists within the same medical group. So you want to be aware of all of those things. So when choosing a plan during open enrollment or during when a person first turns 65, it does take some time. Just like when we're at work and we have our employer options available to us every year at open enrollment. So we may work at the same company, but we may have different needs. And so you have to look at your budget, what your needs are, and try to think what they'll be during the following year. So the Medicare open enrollment period is really about if you're changing your Medicare Part D plans, because you know what's really funny about Medicare Part D plans? They can change every year. The deductibles, their formularies, their co-payments. So what the insurance companies do, they'll say, oh, our Medicare our Medicare Part D plan is changing for 2018. They will send these changes to their members by September 30th.
Okay.
And then they are hoping that the people look over the changes during the first couple weeks of October, so that when the open enrollment begins October 15th, that person can say, you know what, I am pleased with the changes for next year. I'm going to stay right where I am, and for them to do that, they need to do nothing.
So those are changes just based on the provider side, or
Well, the Medicare Part D, since that's drugs, they could be changing their list of covered drugs. They could be changing their co-payments. They could be changing maybe preferred pharmacies, what the person may be responsible, and of course they could be changing the premium.
Right.
So
and then the person also has maybe their situation with what they take might be changing as well.
That's
so
a very good point.
Lot of changes there.
Right. So I think that every year a person should do that exercise by going to Medicare.gov.
Kind of like doing your taxes, right?
Yes, except it's not as stressful.
You have to do something. You have to do, and you have to take some time to put some thought into it, and take a look at your life and what's being offered there, and yeah.
Right. So with Medicare.gov, it takes all the guesswork out of it, because I have worked with people and they said, oh, I've just guessed in the past, and sometimes their guesses were pretty good. But however, I think that they should do themselves a favor and make sure that they're getting the best coverage at the best premium dollars for their situation.
Okay. Now, I heard that some of the Medicare supplements will be going away in 2020. Is this true?
Yeah, so, and that's always a big buzz, right?
Yeah.
So there's a couple things that are changing effective January. Well, actually, next year there's a big change coming, and that's the Medicare cards. The Medicare cards that people have had, it's always been our Social Security number has been our Medicare number. And of course, because of fraud and that sort of thing, they're changing that to a unique Medicare identifier, and that will be 11 digits, and it'll be random numbers, not based on where we live or a birthday or anything like that. So Medicare is going to start that process of sending out cards in the beginning of April.
Of next year?
Yes, of April of 2018.
Okay.
And so there are 57 million people on Medicare. So a huge
It's a lot of unique number.
Yes, it's a huge task for them to do, and they are hoping to accomplish it within 12 months.
And was that for security? I mean, was that?
Yes, it was done for security. So, and it'll still be a red, white, and blue card. The design is a little bit different, but they're going to change some things on there. They're still going to say Medicare A and B, and our effective dates for that, and our Medicare numbers. But the gender, right now there's a gender on there, that will be taken off, and I'm pretty sure our signature line is going to be taken off as well. So that'll be the new card that's coming out. And then the big buzz is, and of course it can frighten people, oh, there's changes coming in 2020 and the beloved Plan F, will no longer be available. However, and it's very important to note this, that if you have Plan F or if you are eligible for Medicare prior to January 1st of 2020, you will always be able to keep Plan F or buy Plan F.
All right.
So that change about Plan F not being available really affects those people becoming eligible for Medicare January 1st of 2020 and beyond.
Okay, what is the Plan F? I mean,
what is the Plan F? That's a Medicare supplement, and as one of my friends says, F is the full plan, right? Because it covers all of the deductibles, co-payments, and co-insurance that Medicare A and B leave you to pay. So it has been very popular since these plans were standardized in 1992. However, there are other good plans too, and Janine, I usually always suggest Plan G, and Plan G, very similar to Plan F, it just doesn't cover one item, and that is the Part B deductible. Now, the Medicare Part B deductible this year is just $183. That is the only benefit difference between Plan F and Plan G.
Wow.
Yeah.
That's for the year?
That's for the, for the calendar year. Now that Part B deductible may change for next year, and so then that would be the difference. But it's always just the Part B deductible that's the difference between F and G. So a lot of people will look at the prices, and if they can find a Plan G for at least $183 cheaper for the year than Plan F, then why not?
Right.
Right?
Yeah.
Sometimes they can even find it at a, even more of a savings than over $183 for the year.
But you're saying those who have Plan F now are good to have it
Forever.
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 Okay.
And if a person is eligible for Medicare right now, but maybe they bought Plan G, they can always buy Plan F later also.
All right.
Okay.
Great. Well, that is a lot of information on Medicare. Any other closing thoughts you might have for anyone?
Well, first, I just want to mention a couple things. The Medicare open enrollment, that really has to do with Medicare Advantage plans and Medicare prescription drugs, not Medicare supplements. Medicare supplements, they don't change from year to year, although their price may change.
Okay.
The supplements don't change, so a person, they don't have to worry about changing their supplement unless they want to. So the Medicare prescription drug plans and Medicare Advantage plans, I believe, should be revisited every year. The Medicare.gov website is a really good place to start that process. And since the Medicare open enrollment ends December 7th, any changes made by December 7th will be effective January 1st.
Okay.
So a lot of people may say, I'll wait till after Thanksgiving. But yeah, I don't know, like I said earlier, it's already Halloween. Thanksgiving is in less than 3 weeks, I think, from Thursday. So I would suggest that they just tackle that now. Maybe tomorrow, sit down for 30 minutes and go to that Medicare.gov website to make sure that they have the right plan for next year. Because what will happen is after Thanksgiving, what do we focus on? The next holiday.
Right.
Right. And so many people will wake up on December 8th and say, I forgot to do it.
And what happens then?
Well, then they are in the same Medicare Part D plan again all next year, unless they have some extenuating circumstances like they move or a few different situations. But typically when you're in a Medicare Part D or a Medicare Advantage plan, you're in it for the entire calendar year. So do yourselves a favor and after this show, go to the Medicare.gov website and check out your options.
Homework, but good homework. Very important stuff. Dan, thank you so much for being with us here today, and thank you all for watching. We'll see you next time.
Thank you, Janine.